And welcome to Sugar Talk here on the talk station FM 107 and AM 1240. And from Diabetes and Endocrinology Consultants, Dr. KG Lucas is with us. Good morning, doctor. How are you?
Good morning. I'm great.
Good. And what are we talking about today?
We're talking about Polycystic Ovary Syndrome, PCOS.
Now, why are we bringing that up in this show about diabetes?
Well, because it's a major risk factor for diabetes, and it happens in about 5% of women at least. It's an insulin-resistant state that leads to ovarian dysfunction, so the ovaries don't work right. The ovaries are sensitive to insulin, and when you make a lot of insulin, we talked about insulin resistance in the past, when you make a lot of insulin, it affects the ovaries and makes the ovaries not ovulate. So that's bad as far as trying to get pregnant, but it also makes you gain a lot of weight. So it's a syndrome. It doesn't mean you have cysts in your ovaries necessarily. It's sort of a bad name for something, but it started off.
That's what I was wondering. What's the difference between a syndrome and a disease?
Yeah, syndrome is a collection of things. So the three symptoms or signs that you have polycystic ovary syndrome is that you gain weight in the middle, which is pretty common. You may have ovarian dysfunction, that you don't ovulate, and you have evidence of having too much male hormone, testosterone. So some people get more acne, some people get excessive hair growth on their face, some people get male pattern, these are women of course, male pattern hair loss on their head, or their testosterone is high. And that's because if you don't ovulate, what happens is the egg just dissolves, and the cells that are left over tend to make male hormone instead of what they usually are supposed to make. They're usually supposed to make progesterone when you ovulate. And that's why when you ovulate, then you make progesterone the last 2 weeks. Some people get grumpy, irritable, and bloated. And then they have their period after the progesterone and the estrogen drop. So in polycystic ovary syndrome, what happens is you just have estrogen and you don't ovulate. And you might have real heavy periods, or you may have no periods. So you may skip periods for months at a time, and that's not normal. Even though a lot of people like it, I think it's great, it's not normal. So if you have, especially starting at puberty, so some of these girls get periods early because the insulin makes them grow quicker and mature quicker. So they get breast early, they get periods early, and then they can start gaining weight around that time. So some of these girls get periods when they're 10, the average age is 13. So you're getting them early, and they gain weight in the middle, and they continue to gain weight. They continue to have irregular periods, and about half of them get diabetes by the time they're 35, and that's type 2 diabetes. So that's usually, you think of that as being older people, but these people are younger, they're more insulin resistant. They also, if they're severely insulin resistant, they can have this dark, thick skin around their neck, under their arms. They can get skin tags around their neck and under their arms, and that's a sign that you're insulin resistant. So every crease on your skin, the knuckles, under your arms, and your groin area can be dark and thick, and that's from too much insulin. That's not just from not washing yourself. So some parents try to scrub it off their neck, and it's really pigmented skin, so you can't really, it's not dirt.
So is there sometimes a diabetes diagnosis that goes along with this? Or, I mean, is it chicken and egg kind of thing?
Yeah, not usually. It's usually they're insulin resistant. So when you have those three things where you have the central weight gain and the belly fat, more belly fat, irregular periods, not ovulating, and you have too much male hormone, those are the three things that constitute the syndrome. It doesn't really say what causes the syndrome by just those three things, because there's other things that can do that. But if you're overweight, you have family history of diabetes, you have that, it's called acanthosis nigricans, that dark, thick line around in the back of your neck, then you have that, and the best way of doing it, treating the whole thing, is to treat the insulin resistance, because that's what causes it in the first place.
People are going to be walking around today looking at dark, thick lines on the back
it's
of their neck.
It's hard to see the back of your neck. Have you ever tried to see the back of your neck?
No, they'll look at other people though. But this is this something that you can treat and then stave off diabetes, or?
Theoretically, I don't think anybody's done any studies to prove that, but the idea is if you make 5 times more insulin than normal, you're going to wear out your pancreas quicker. So if you can take medications that lower your insulin level and get everything back to normal, then you don't wear out your pancreas as fast. You may still get diabetes, but it may be postponed 20 or 30 years, which is fine, because there might be some perfect drug by then. But there are, metformin has been used for it, other medications for diabetes have been used for it, such as like Victoza and Byetta, those type of drugs, because they tend to make you make less insulin. So any medications that make you less insulin can help out. It helps out with the weight loss. It helps out with the periods. If you're trying to get pregnant, helps that. Now, metformin is the only one that can be used when you're pregnant. So if you're on other medicines for this syndrome, you need to stop them when you're trying to get pregnant.
Does this show up at the onset of puberty? Is it later?
Or? A lot of times it does if you ask them. I don't think people recognize it at first because the periods can be irregular right when you first start having periods, like the first year or two. So most people just ignore that. But later, like a person that's been pretty normal weight and they start gaining a lot of weight in the middle, I think you should be aware of it. I think some of the pediatricians are pretty aware of it, especially that dark line around the neck. A lot of pediatricians pick that up too.
So, yeah, because I would imagine, again, this is something that unless that conversation is had early on, you're not going to really pick it up until.
Well, it's sort of obscure. You would think that with the internet and all this information, everybody's supposed to be smarter, but they still...
No, we're looking at pictures of cats.
Yeah, cats on Roombas.
Cat videos.
Is that favorite? Anyway, yeah, so you would think they would have it, you can search for irregular periods and things like that, and a lot of times they'll pop up. There's not a lot of in-depth information. There's just more superficial information on it, but it's something to consider and get tested for.
Okay, again, Polycystic Ovary Syndrome, right?
Yes, PCOS.
PCOS.
It's easier to say.
Okay, so that is something you may want to have that conversation with. If you have daughters, you may want to have that conversation with their pediatrician, right?
Yes.
Just to be on the lookout for it. Coming up, we'll have more on Sugar Talk with Dr. K. Jean Lucas here. Hey, welcome back to the program, Sugar Talk with Dr. K. Jean Lucas from Diabetes and Endocrinology Consultants. You can reach us if you'd like to ask a question at 800-818-2255, 247-7282, or 353-4674. And so, Dr. Lucas, you had diabetes school this past weekend. You had a little storm right beforehand, though, but a good crowd.
But people still came. I think they probably showed up before the storm. We had a good group. We had about 50 people, and they asked a lot of good questions, and they had a good time.
And then your next one's not until October, but it's going to be at the aquarium this time, right?
October 15th at the aquarium. Starts at 8:30. And if you're interested in it, you can go to the website, beachdoctor.com, and there's a sign-up sheet, or you can call the office.
Okay. You go to beachdoctor.com, again, and get all the details. Where you also get details on studies. Now, tell us about this new triglyceride study.
Well, we're looking for people with diabetes that have elevated triglycerides that are not controlled. The triglycerides have to be over 150, which normal is 150, but they have to be on a statin drug if they can tolerate statins. If they can't, that's Crestor, Lipitor, atorvastatin, simvastatin, pravastatin, all the statins. So if they can't tolerate statins and they still have a high triglyceride, then they want them. And it's using a drug called Praluent. Sorry, Repatha's the other one. Praluent. Praluent is an injectable medication every 2 weeks, and they want to get it approved for triglycerides. It's already approved for high cholesterol, and they want to get it approved for triglycerides.
Okay, so again, people with diabetes and high triglycerides.
High triglycerides that are not controlled on either medicine, or they can't take cholesterol medicine.
All right, now you still have some other type 2 studies too.
We have some type 2 studies, metformin only, metformin plus either Farxiga, Invokana, or Jardiance, metformin plus Victoza or Byetta or Trulicity or Tanzium. So injectable plus metformin, or the SGLT2s, which are the Invokana, Farxiga, Jardiance, and metformin, or metformin only, or no medication.
Now you are you're naming off a number of drugs that we see ads for all the time. So what are you looking for, or what are the studies looking for with these already approved drugs?
The one study using Victoza and Byetta and the GLP-1 injectable drugs is they're coming out with a mixture of insulin plus one of the GLP drugs. So it'd be like, Victoza plus Lantus in one pen, and it just got approval from the FDA committee. So it's almost getting approved. And this is another study comparing just Victoza with the mixture. So you get Victoza or you get the mixture, and you'll know which one you get. So that's one study. The other one with the SGLT2s is actually adding Trulicity, which is an injectable once a week drug that keeps the blood sugar from going up and down. And that will be interesting. They're trying to get it approved with use of those drugs. So that drug's already been approved.
If you want to find out more, go to beachdoctor.com for diabetes and endocrinology consultants, and join us every week for Sugar Talk with Dr. K. Jean Lucas. See you next week.
Okay, thanks.